Oh, fantastic. All right. Well, good afternoon, everyone, or for many of you, perhaps still the morning. It is afternoon for me here in Washington, D.C. Welcome to our second to last workshop session of the conference. That's pretty incredible. So for those of you that haven't had the chance to meet me yet, I am Lauren Rabinowitz. I will serve today as your session facilitator, and I am joined by the incredible Don Yazzie, who has just done so many things for us in this conference and is about to do one more that's going to be of extreme use for everyone. I'm so excited that she is going to be doing this session today. We have Leslie in the background, who is our technology host. Any questions, issues, anything that you might have, please put them in the chat. And as you've probably heard many times throughout this conference, but I am going to say it one more time, please know that the views, policies, and opinions expressed in this presentation are those of the authors and do not necessarily reflect those of SAMHSA. So with that, I'm going to turn it over to Dawn. I'm going to be here as well, not far away if anyone needs anything. So thank you so much, Dawn.
Thank you, Lauren, for all the support and helping with the last minute fixing of slides. Welcome, everyone. Happy you're here with us. Go ahead and share the slides, Leslie, as we get started. So one of the things that we wanted to try to hold, for this conference is it's like kind of hard to explain like what is infant and early child mental health consultation. It's so like nebulous, and where are the edges, what is it, what it is not. And because I think so often those of us working at the center, we talk with folks around the country, and we hear maybe a program or someone in a Head Start or somewhere at childcare, tribal childcare or tribal Head Start, and they'll say, we have a consultant who comes to our center. Yes, they meet the mental health standard, part of it. But they don't know birth to 3 or they don't know birth to 5, so we have this, language of what mental consultation is, maybe in a policy or in a law, but to really describe it in the way that the Center of Excellence describes it, that's what I hope to bring to you today. And for questions, put them in the chat. I'll get to them as I see them, or Lauren will catch them too and ask them. Let's have a back and forth. I don't, want it to be so strict, and where we save it at the end. Let's just, jump in and share as I move along with this. I work part-time for the Center of Excellence and a couple of other TA centers, and also do some private contracting work as well on the Navajo Nation and in neighboring states here. So I come to you from Fort Defiance, Arizona. Next slide. And as I shared before, I did do consultation for about 8 years in the Navajo Nation and learned, the consultative stance, read Khadijah Johnston's book, and was, very fortunate to be steeped in it in 2015, and kind of wrapped up that work of on the ground consultation this past June, but I'm still doing it in private work. So here's our little agenda of what we'll try to go through today, and we'll hopefully get through all of it. But if there are a lot of questions, that's okay. We'll find a way to get through to the very end of it. Next slide. And then we also had a little bit of a technical issue with our Kahoot game. It asked me to pay for a year of service, $300 and something. I was like, I'm not going to do that to set up a Kahoot game. For some reason, it wouldn't let me go to their free version. So Lauren jumped in really quickly, and we have it just in slides here for you to take a look at. But here's the definition that we have from our website of what consultation is. It's a prevention-based approach that pairs a mental health consultant, mental health professional with adults who work with infants and young children in the different settings where they learn and grow, such as childcare, preschool, home visiting, early intervention, and their home. Mental health consultation is not about fixing kids. It's not therapy. Mental health consultants equip caregivers to facilitate children's healthy social emotional development. And keeping in mind that in ECE, we typically think, oh, ECE, education, learning, ABCs, one, two, threes. We think of just a child, but really it's always, always a child in a relationship. I think one of our, our famous infant mental health voices, early on always said it's a baby in a relationship. They're never a baby separate. So that's why this focus on supporting the adults around the child is there. Oh, you don't see the PowerPoint, Emily. How about others? Do others see the PowerPoint? Oh, on the conference website. Yeah, we'll get it up there. We'll get it up there. Absolutely. Okay, next slide. Okay, so here's our little quiz that we had to change from a Kahoot quiz to this one. So let's look at question number 1 together. And feel free to put it in the chat. If you don't want to, that's okay. But this first question, who benefits from IECMHC services? Is it children only, educators only, parents only, or is it children, family, and educators? Okay. I see a lot of folks putting in, yep, D, thank you for signing. Yes, children, family, and educators. Yes, that is absolutely correct. Awesome. Okay. Next question. What is the primary goal of infant and early childhood mental consultation? So you have 3 choices there. Diagnosing mental illness, supporting the mental health of children and families, supporting the ability of adults to support children and families' social emotional development. Okay, C, yep, the last C, number 3, the last one. Yeah. Yes, supporting the ability of adults to support children and families' social emotional development. Yes, related to the first question there of supporting the adults. Next, the third question is IECMHC is a time limited service. True, false, or depends? Okay, I see depends. 3, wondering. Yeah, 3 depends. Absolutely. It really depends on your program structure, what we used to call model. What is your program structure? What is your consultation program like? How have you developed it to look like to meet your local community's needs? I've heard of programs across the country. Some say we have like a 5 to 7 year limit so that we can, move on and serve more after that time frame. More centers, more programs, agencies who want consultation services. And some say we have a 6-month time frame, and others, maybe they say 2 years. Khadijah always jokes about when she was in the Bay Area and was a director of a program. I think it was the infant parent program at UCSF. And she said, "Oh, we have the infinity model where they kind of never closed a program." So yeah, it depends. Okay, so number 4, which of the following are true about IECMHC? So you have 4 of them there. IECMHC is a direct service to children. IECMH consultants and pyramid model coaches provide the same service. Consultants identify issues in children and fix them. Support the skills of adults to reduce the impact of mental health issues. Okay, CD. Support skills of adults. Yes, okay. All right. Okay. Last option. Yeah, so the correct answer would be the last option there. And if you, chose any other one, but you didn't want to put it in the chat because you were not sure, that's okay. You're in the right place here to kind of clarify a little bit more, hopefully, kind of what your understanding of this type of consultation is. Okay, next slide. Thank you, everyone. So the last 3 questions here. The most salient driver of change in IECMHC is the consultant's years of experience, the consultee's years of experience, the center of excellence, the quality of the consultant and consultee relationship. Okay, I see folks putting in their quality of relationship. Relationship D, last one. Yep, 4th one. Okay. Yes, that is the correct answer. The quality of the consultant and consultee relationship. As with any infant mental health work, it's relationships, relationships, relationships. Very similar to consultation, all about the relationships. So when you think about your model or your program structure of what does our consultation program look like, I don't know if 6 months is enough to build a strong relationship, or if it's less, I don't know. That's a really good question. Thinking about the communities you're going into. Okay, question number 6. Consultation has been identified as a specific approach to address all of the challenges except early childhood suspension and expulsion, identifying developmental delays, enhances the overall quality of the classroom environment. A little bit of a trick question. Yeah, I see a number of answers, but yes, that is right, the second one. So it is an approach that can support with suspension, expulsion, reduction, and then it can support with enhancing overall quality of classroom environment. It is not to identify developmental delays, although sometimes consultants can see things that maybe teachers don't see. And it's the teachers and the agency and the families that are work together, and a consultant can support the process, but it's not specifically for identifying, if that makes sense for everyone. So last question we have: reflective consultation / supervision can be used as a space for providing psychotherapy to families, teachers, and staff, discussing issues related to race, gender, sexuality, ableism, etc. Reflective supervisors to check on consultants' productivity. Okay, I see a lot of folks putting in the chat. Okay, yeah, it is the second one, or B. Reflective consultation supervision can be used as a space for primarily this part here of discussing, our biases as consultants when we show up to centers, or maybe we witnessed a bias, maybe we witnessed discrimination, racial discrimination. Yes, you will receive the PowerPoint, and we'll make sure we put in the answers when we send out the final PowerPoint here. Yes, discussing issues related to race, gender, sexuality, ableism. That is a place, etc. Things of that nature, a place to discuss to be discussed in reflective consultation supervision. Okay. All right, let's move on to our next slide. Anyone have any thoughts or questions, surprised by any of the answers? Okay, if there are none. Okay, so what is consultation? It is within these realms of promotion, prevention, intervention. It is not in the treatment realm. It is an indirect service. It benefits young children and, like we saw in the poll, teachers, families, directors, provided by master's prepared mental health professional, builds the skills of families and professionals, supports healthy social, emotional development of young children, delivered in a variety of settings in the community. So consultants go to the community settings. So what consultation is not, it's not a direct service, it's not treatment or therapy. It's not focused only on families. It's not always provided in a center-based setting. So consultation can be done with home visitors. It's not group therapy. And as we heard in just the plenary before, We heard of consultation being done in pediatric clinics with child welfare programs, and moving into even safe baby court teams. So lots of possibility. Anyone that works with human beings, anyone that supports young children and those that take care of them, it is a place for consultation, in my opinion. Not psychological treatment for staff. It's not psychological treatment for families or children as well. It's not solely training. It's not only training. It's not only professional development for staff. It is, yes, sometimes consultants do training. Yes, sometimes a director might say it's a part of their professional development, but it is always in a context of a relationship, in a context of talking about what teachers may need to learn or know about, within social emotional development of young children, and the relationship based work that teachers and children, have moving every day, that teachers and teachers have, that directors and teachers have. So it's not just training, or a consultant does training, that's it. I don't know if that's consultation. There's a lot more to it. So it's not pyramid model coaching as well, although pyramid model is very helpful in understanding some pieces around social emotional development. Okay, next slide. Okay, so I know in that slide before I said that it's, by a mental health master's level prepared mental health professional. This is definitely up for discussion in many states and programs, but I will share here kind of, what is recommended by the Center of Excellence, that we do have a master's level trained mental health professional, someone who is licensed or licensed eligible, a seasoned mental health professional who has experience using their clinical skills in the work daily. It's very helpful to have that, who has a little bit of experience under their belt, adheres to all license certification ethics as a mental health professional. There is daily use of clinical skills, even though we're not doing therapy, for the consultees that we support. Okay, so I highlighted these here, that this is a hard thing to do for rural communities and tribal communities, or any other under-resourced areas, to find a master's level trained mental health professional. We've heard it in many presentations throughout this conference. The question has come up often. It comes up daily, and I am kind of on like this fine line of if they have a master's in maybe public health, and maybe their focus is on social emotional development, or their focus is on mental health, or they have a master's in ECE education, and then they had additional experience doing social work or something, in their undergrad. So it's kind of like, it really depends on your program administrators, who they have to support. I know some programs have licensed folks who are supervisors, licensed mental health professionals, and they carefully screen and do 2 or 3 or 4 interviews to see if this person's a good fit, if they don't have a license or a license eligible in mental health or social work. So really depending on your agency, because I have heard of agencies, bringing in someone who has, kind of all the right experiences in their life, and, very seasoned in their work. I see a lot of, I think my chat's coming up here, and that's good. So let me go to the chat here. Can you talk about
Trying to get to some of them, Dawn?
Yeah, clinical skills that are used daily in consultation. Yes. Resources, websites, or information about differences between states concerning infant and early child mental health, or are you talking about consultation? A little clarification there. Okay, and then Alicia has shared answer of sort of. Okay, SUI has a number of resources available from different programs. State yes. Okay. Okay, mental health. Okay. So I have in here the clinical skills that are used. So if we think about um, being trained as a mental health professional, whether it's in social work or counseling psychology, or if it's a doctorate in psychology, whatever that clinical realm is, because we know there's school psychology, there's the clinical mental health side of psychology of treating mental illnesses. And then there's also psychology related to like developmental psychology. There's also psychology related to what's that one? I'm missing the words here. I'm blanking on it. Anyhow, it has to do with education based, like finding your career goals, those other areas of psychology. But the clinical skills that are used as an infant and early child mental health consultant is when we come into the center, we look at the center as a client in a sense. And when we, in the field of mental health, professional mental health, you have certain forms that need to be filled out and signed. So from the get-go, is there a mutuality of endeavor from the consultative stance? Does the center want consultation services? So if it's a yes, then we come together and say, okay, let's go into this agreement that you want us here as a consultant. We would love to have you as as a center that we can come in to, partner with. And there typically is a form that is signed that here is what I will do as a consultant, and here's what you will do as a center. The center says we will make space, for you to maybe they want trainings done around mental health, around challenging behaviors, around social emotional development, around attachment and building relationships. And then they'll say, and they say, we would love for you to come this many times in a month, maybe it's 2 or 3 or weekly. And, we know you'll be here at this time. Consistency is important in building relationships. So you have that document that is very similar to going into a professional mental health relationship with a therapist. So even though it's not therapy, there are still certain documents and items that are pulled from the field of professional mental health so that it can be an established relationship with important boundaries that are set between the mental consultant and the center. So there's like right there kind of a structuring skill already. And then as a consultant, when you go into a center, you hold multiple relationships. So you kind of have multiple hats and you have confidentiality, certain levels of confidentiality that you're holding in these multiple relationships. You might have a teacher who can't stand the teacher they're working with in the classroom, but you hold each of them in their own space when you have time to meet with them, when they, want to share with you. Or you hold maybe a director who is having a huge conflict with one of their teachers. And you still are holding and being true to each of those relationships. So, and you still maintaining that confidentiality. So there's those parts of the clinical skills. And then another clinical skill that is, I think more rooted in infant mental health work in attachment theory. A lot of folks, they have infant mental health skills, but also there's a consultation piece that is tied into infant mental health, having that knowledge base. So one other skill is just to give an example, 2 examples. I had a center where I was watching a 4-year-old classroom, and this teacher is phenomenal. She's wonderful. And I noticed that she was, giving positive support to a child, but I noticed they were a little out of, kind of almost ready to hit a child in their dance time, almost ready to push a child, while they were in circle time. But, the teacher had a wonderful way of, mentioning their name, but turning it positive. She didn't say, no, don't do that. She was just awesome in that work. And I was thinking, oh, she's paying attention to a child. And, this was a new child in the classroom, and I didn't yet know the child, didn't know the family. And also one thing that I noticed, it happened to be in the morning I came, and then in the afternoon I came. I wanted to see what, pickup looked like when the parents would come into the classroom. And I noticed this particular little one that the teacher was, kind of supporting a little more intentionally. And the little one saw his mom come into the classroom, and the mom, did like a little smile and greeting, and she kind of held her hands open. And then the little one, his initial reaction upon seeing mom was excited. And then he took like 2 steps towards her. And then he went like this, almost like, ready to do something. And when mom saw him shift, she went like this to protect her body, her, abdomen area. And when they got closer together, he pushed into her really hard and kind of like, almost hit her belly abdomen area. And I was like, interesting. And if we think about that from the infant mental health perspective, when we think about separations and coming together again, what does that say about the parent-child relationship? And then how might that behavior translate in the classroom when the child's building a relationship with the teacher and the child? So that's just an example of, looking for those little nuanced pieces of the teacher-child relationship. How is that child with other children in peer relationships? Is this a child that, his typical way of greeting mom is with a little bit of aggression? And, okay, how are we going to support his learning and brain development, that there is another way to greet, a caregiver? And, the teacher in that space was wonderful at doing that and supporting that little one. So I know that's a long-winded answer to an example of a clinical skill. And I also have another example that was, pretty intense, kind of in my last few months of being a consultant. And it had happened in other situations, but this one was more intense, where I had a center who had a secretary. And the secretary, was always nice, always kind, really busy, greeted parents and greeted me, and I signed in and signed out. We would talk briefly and, just really kind of surface things about the weather, how she was doing. And she never kind of really shared with me. And I did have another secretary, who would share some things with me, and just, I just support and give resources and information. And, but majority of my time was with director and teachers. But one day this secretary said, can I talk with you after, towards the end of your day today? Can I reach out via email? And I said, sure, gave her my card, and she reached out towards the end of the day. It gave her time. And she wanted to talk by phone. So we talked by phone, and she said, I'm at home now, but I want to share with you that I'm worried about my child. And her child was 15 years old, and said that, they seem sad. And so I kind of asked some questions, okay, what is it around being sad? And come to find out, what ended up happening, even though the mom didn't share this, and that I was able to speak with the child, because it had seemed like it got to this level of, ooh, is there a harm to safety or others, safety to self or others? I heard some of that language and kind of prodded a little more with mom, asking, do you have a concern for your child's safety? And I don't know, I'm not sure, you can talk to my child here, and, talk with the child. And come to find out, I needed to meet mom and child in the ER for, there was a plan, a thought of suicide, there was a plan, and there was access. So in that moment, I don't know, without my training, my clinical training, I don't know if I would have caught that, if I would have kind of gently prodded and asked a little more gently, the way that, I did, I don't know. But it was pretty scary that, in that moment, I had to meet them at the ER. And it just so happened that mom was willing and the child was willing. So met them there, and they checked in, and they called in the psychologist at the hospital. And she had to go on a week hospital stay to keep her safe. And I saw them several months later, and they're doing well. And child is in therapy, mom is in therapy, and they're doing family therapy as well. So just an example of the clinical skills that are needed with things that come up sometimes. And I see so much going on in the chat, and I don't know, Lauren, if there's anything that I need to ask. Yes,
I
Harmony.
think you're fine to keep going. Lots of amazing connections being made within participants. So yeah, I think let's keep going. This is
Okay,
awesome.
awesome.
I will
Yeah,
stop you, no worries.
okay. All right. And the other part of, rural and tribal communities. So I know, like for Indian Health Services, the federal funding that comes to many tribal communities, not all of them have this funding, but to many tribal communities in the 90s and early 2000s, they established positions that were called behavioral health technicians. So someone who had a bachelor's degree, but they were doing kind of, mental health work, but they were supervised by someone who is a licensed mental health professional. And some of these folks have maintained their positions for 15, 20, 25 years. And they have this, the clinical skills. They, speak the clinical language because they've had that support, but they've never had the opportunity to have their education paid for to get a master's degree. So, those are things that would be, intense conversations need to happen for examples like that. But I would definitely support, you're in your consultation program, in your program structure, when you develop it, what is your workforce pathway? Who are you going to recruit? Are you going to go to the universities and talk to the folks who are in their BA programs in social work and psychology? Are you going to say, hey, we have money, apply for, your master's in this area and we'll pay for you? And, here's some more trainings around early childhood development. Here's some trainings around, here's consultation. We would love for you to do this, so really starting your pathway really, really early on in the professionals. I'm always, when I was doing consultation, I was always recruiting folks, who were maybe employees and programs of similar, early intervention programs, or if they were teachers, and I'd say, have you ever thought about getting your master's degree and being an early childhood mental health consultant? So always recruiting. Okay, next slide. So definitely put in your program structure, if you have the money, ways to support continuing education for folks to get their master's degree in the needed areas. Okay, so here are some resources that can help to kind of delineate consultation a little more. Consultants are often confused with pyramid model coaches, or they're confused with maybe an early learning coach, or Arizona has a pretty robust early childhood system that comes from state funding. And sometimes a center would have a mental health consultant, an early learning coach, a health care consultant, and an inclusion coach. So like four of us, and then it's like dizzying. They're like, who's who now? And so the way I would describe it is, okay, your healthcare consultant focuses on like sanitizing, desks, tables, high touch areas, hand washing, when to call parents when children are sick. And then I would say your early learning coach really supports your, curriculum development and, in what you're doing in teaching, maybe the classroom structure. Your early learning coach, maybe supports how much, you should do for circle time, or, what's developmentally appropriate for the classroom. And then, I would say for me as a mental health consultant, I support all things social and emotional development related to mental wellness for adults and children, and, just everyone in the space. And, what can I do to support learning about that and raising it up? And I would tell them too, so I support you, the staff, so you can better support, the children in your classroom, their social emotional development. So that's how I would describe it. And I see a few things more in the chat. Okay. All right. So All Hands on Deck is a resource about the difference between pyramid model coaches and consultants. They can definitely work together. The more brains, the better, I always say. And then there's the resource where, if you want to still learn, like, gosh, what is consultation? This is a great article to go into the COE website. And it's a good read, a really good read about an example of what a mental health consultant does during their day, um, how they support. And then the consultation foundational modules, if you wanted to learn about what is it that I need to know, these are really good modules to go into. They're on our COE website. And this one is new. I heard in a session yesterday where they talked about this crosswalk. Okay, so there's infant mental health competencies, right, that are put forth by, the Association for Infant Mental Health, and different states have organizations that go to it. And then there's also consultation competencies that we have in our Center for Excellence website. And this crosswalk compares them, and you can kind of see the line and division of what is done, what is not done, what are the similarities, and what are the differences. And then there's, if you're a new consultant or you're an experienced consultant, but you want to okay, let me see, what is this here? What is this consultation that the COE is talking about? Here is a self-assessment, and it is infused with equity as well as our foundational modules. With the self-assessment, it takes a good, I would say 8 hours, can be give or take a little more, hour or two. It is a really good place to kind of ask yourself these questions on what you might need to strengthen your skills in. You go to the website and you register. I see Lauren's putting things in the chat there. You register and then you log in. You have a login name, and it saves your progress. If you go in and do module 1, your self-assessment, and you need to leave, go somewhere, you come back the next day and it'll take you to the next part. It saves your data for you. So any questions about that? Anything, Lauren, that I might have forgotten?
I mean, it's a great place to start this list. There's a ton here, and there's even more when you start playing around on the website. But I think this is an awesome list to start with. I'm going to keep
Okay.
posting links for y'all.
Alrighty. Thanks, Lauren. Next slide. Okay, so we know that there's this, what does a mental health consultant need to know? I kind of described a little bit already, but of course, here's the famous 0 to 3 infant mental health definition. And I want to be clear that anyone can learn infant mental health. I've known teachers who have an infant mental health lens, even though they're not endorsed, and they don't know that they have this lens, but I hear it in the way that they talk and the way that they work with children. So, but if we, this piece of being, I guess, fidelity, this piece of, being endorsed, it's a big thing. Yes, it's, but sometimes that limits folks' access, and folks are limited to other, people in their region who know infant mental health, and maybe they can't get endorsed because there's no one that, maybe they don't have the money to pay for that kind of reflective supervision. So just, lots of things to think about, but here's a definition of infant mental health. You don't have to be a mental health professional to learn about this way of thinking. Again, it's a whole field that is in promotion, prevention, and treatment, the infant mental health field. And we know that consultation lies in promotion, prevention, intervention. Okay. And just at the bottom, the consultation, this kind, is not in the treatment practice part of the infant mental health continuum. Okay, next slide. So I kind of did this little visual here. So here's foundational knowledge that a consultant should have. They should know trauma-informed approaches. They should know what trauma-informed practices are, and know what trauma looks like in children birth to 5. And then also thinking about early childhood developmental knowledge. It is very helpful to know, okay, if we go into an infant room and you have an 11-month-old who maybe doesn't want to make any eye contact, and maybe they're not sitting up on their own yet, maybe they're not babbling yet. Is that typical or not typical? So, lots of things to think about. Maybe you're in a toddler room and you see a little one who, is not able to walk yet, and they're 18 months old. Or maybe they have a weak core and that limits their ability to, to go crawl to teachers when they want to be picked up. Maybe it limits their ability to sit up adequately and then eat, in their high chair, and they kind of slouch into their chair. So, really thinking about, okay, if kids are hungry, they're going to be grumpy, and, it's going to affect their social and emotional development and their social emotional way of being in the classroom and interacting and being able to be in a relationship with a teacher. And then the other one that's also important to know is attachment theory, kind of what I described about, seeing that little boy and wondering, I'm wondering what that relationship is like for this little boy and his mom. And how might that relationship transfer over to, the teacher or not, wondering about that. And then reflective practice. Very important to always have that as an infant mental health consultant, an infant early child mental health consultant. And then if you click one more, Leslie, there should be another piece that comes up, or maybe it won't come up. Yep. Okay, there we go. So in all of this, it is really important for a mental health consultant to also know the culture of your program they're going to, the setting. It is also important for them to know the world of ECE. And here's all the areas of development that early childhood teachers know about and learn about when they go to school or get their certificate. And then also knowing what's childcare like, how is it? Knowing that it's pretty typical if teachers, don't even have a restroom break and they have to call someone, come relieve me. I got to go to the restroom, and they're only teacher in the classroom. Unfortunately, that's sad, but it is typical. Or knowing if it's a pediatric clinic. Okay, how does that pediatric clinic run? When are the meetings, where doctors and nurses come together? And also, it's important to know adult mental health. Okay, this is, all these pieces here where clinical skills are applied, and you bring this piece to, thinking about a center, wondering about a center. What are all the levels of influence in these dynamics, in these spaces, to truly be able to support them where they are and what they show up with. Okay, next slide. So more foundational knowledge. I'll go ahead and keep going. I think there's 3 or 4 of them here. You should go up to 1, 2, 3. Yeah. Okay, good. So the other part of foundational knowledge is, yes, that slide of, having the frame of infant mental health lens, knowing all of the development, knowing the setting, and then you layer that in with a consultative stance. So we do have a brief, I don't know if Lauren put it in the chat yet, but we have a consultative stance brief that describes each one of these. Again, I shared mutuality of endeavor, avoiding the position of sole expert, not coming in saying, I'm the expert, I know what to do, try this, this, and this. But you come in as, yes, I know some things, I have some experience, but, I honor you, the director, the teacher, or parent. You guys are the experts. You're here every day with a child, maybe 9 hours a day, Monday through Friday. You know them best, you know them better. And, you've tried a lot of things. I'm here to just, listen and be with you and wonder with you about how can we support this little one? What can we do? Wondering why, these behaviors might be this way, wondering why they're crying, for this long when there's drop off. So just, thinking together, coming in as not coming in as an expert, but coming in as, I'm here to support you. You are the experts too. I want to learn from you. Holding the parent as expert is really important, caregivers. And then this part of wondering, instead of knowing, instead of coming in, well, child is showing this, try 1, 2, 3, 4, 5 strategies. It might be more in a, okay, let's kind of slow things down, wondering, what have you tried? Is there a particular time of day this behavior happens? I'm wondering if there's a change in the child's life at home or at school. What maybe a teacher shift change happened and they had a strong relationship with his teacher, and the teacher had to be moved to another classroom suddenly. So knowing how those dynamics can influence a child's life, wondering about all of that instead of knowing. Because I think when we come in with knowing or assumptions and assuming, we limit what else could possibly be involved in the situation for a child or a family or a teacher or a director. Okay, next slide. I think you'll have to click again for the next three. Oh, it came up. Good. Okay. So understanding another subjective experience. How am I on time, Lauren? Going along here. We have 8 more minutes. Is that right?
Yep, we go until 2 o'clock.
Okay. All right. So I think we talked about this a little bit yesterday in our plenary with Khadija, Irman, and Eva, where you understand your own objective experience and your experiences so that you can better understand others. You hold their perspective, and especially the child's perspective. It all ties in together, the consultative stance. But knowing that, this way a teacher thinks about a child, even if the teacher says, oh, let them cry, they can cry it out, they're fine. It strengthens their lungs, you know. Is that, particularly good for having a child having a flood of cortisol in their body, in their developing system, every day. Knowing what cortisol does to all of us as human beings. Yeah,
Hey,
very,
Don,
very.
I'm
Yeah.
so sorry. I messed up. We are done at in just a couple of minutes, like 2 minutes.
Oh, okay.
I don't know how you wanna. I'm sorry. I've been
It's
multitasking
okay.
too much trying to get these links in the chat. But Carla actually just did put a really, really great question. And I think it would be
I
wonderful
see
for
it
you to
there.
respond
Yeah.
to it.
Okay. Go ahead and move to the next slide and I'll answer this question while you're doing that. Can you speak to responding to caregivers, teachers who see the consultant as expert, example, their capacity or confidence is low? Yes. So I've had teachers, say, Dawn's our expert on child behavior. And I'll say, I'll say I'm a tiny bit of an expert. Yes, I have some information. I've learned some things. I've gone to school. And then I'll say, but, I also see you as you're an expert too. Um, what your child loves, likes to eat. How your child, likes to go to sleep. You know what the challenges are for your child. Your child's favorite toy, or whether it be a teacher or a parent in the classroom. And I will say, let's figure this out together. And you're my other person that I'm going to rely on, to find out some things. I don't know everything. I'm going to be curious and learning about the child in the classroom, and your ways of running your classroom, your ways of how you are with the child at the home. So you're an expert in your own way. That's what I usually say to them. um, okay. Next slide. So you
And
see the
then we'll
10
have
there.
to
Go
wrap
ahead.
up just so we can open up the next set of
Yeah,
rooms. I'm so sorry.
yeah.
I was
No,
should
you're
have given
fine.
you a
You're fine.
bigger warning.
You're fine. Okay, next slide. Next slide. Okay. Yeah. So this is your program structure. If you're building a consultation program, how often do you visit? How much time do you spend at the site? Yes. How many consultants will you have? What will their caseload be? Who will be their reflective consultant supervisor? What service settings will you go into? How will you fund your consultation services year after year? Next slide. These are places you can learn about infant mental health. Note that Georgetown University so far is the only place that has a consultation, introduction to consultation, in this way that I'm sharing with you all. There are other program structures, other programs across the country who are developing their own in this way. So, definitely reach out. Next slide is about if you want technical assistance, all free, to learn about setting up this kind of consultation program, you can absolutely do that. Next slide. Okay, next slide. Okay, I think that's the last slide. Yeah, so I didn't put in there, I thought I did, but you can reach out. There's our website, and on our website, you can request technical assistance. It's free. We can help you in setting up your consultation program. Thank you, everyone. I really appreciate you being with us here. And someone just shared that they often say they know that I may know child development, but this particular child. Absolutely. That's a great one. Yeah.
I love that all so much. Dawn, thank you. Thank you so much. And a huge thank you to this group. What an amazing, amazing group of participants. I really love all the connections that you were starting to make with each other. Make sure you know that you can download the chat. Just click at the bottom of the chat, the three little dots. If you click that, you can save this. And we will get these slides uploaded. And we'll see you in the next session. Thank you, everyone. Thanks, Dawn.
Yeah. Thank you, Lauren.